Wonderful. Thank you to Sophie, Shannon, and Aurora for walking us through some examples of what you can find and how you can use the toolkit. We have a number of questions in the chat that I've started to address, but maybe we can talk about each a little bit more. And I also want to invite Shantala Ahanya, one of our HAI program infection preventionists, to join us for the discussion and maybe moderate a bit. But let's see, there is a question about the full trainings. If I use the full training, how long will this take? So thank you for your question, Rebecca. We have designed the slides so that there are about 20 to 30 minutes worth of content. So if you use it out of the box, use every single slide, including the knowledge checks and the recommended kind of pause for 10 seconds for thought and discussion, 20 to 30 minutes for each module. So you can easily do this. If you really want to do it intensely, you can meet for an hour and cover 2 topics. You can take your time with this, maybe meet monthly. Really up to you how you want to customize your training. And then with all of the FAQs that you saw and the additional kind of resources, you can create further discussion with your staff. There was a question about languages offered, if there was English and Spanish only, or if there were any other languages available. And right now, just English and Spanish so far. We are looking into what languages would make sense to translate into next. And I mentioned in the chat, if you are a facility or a region who has the resources to translate materials into different languages, we encourage you to do so. We also want to ask if you would share those with us, but definitely use the materials as is or however you need to. And then there were a couple of questions about where can I get a copy of the slides, and we'll share those at the end of this week's workshops. You'll get an email. It'll also be posted on our Train the Trainer website. And then Shantala, and there was a question from Nina Havate regarding using nail clippers to trim nails. So I'm looking in the gallery to see if Nina is available to come off
I'm
of
here.
mute. Oh,
Hi,
great.
can you hear me?
Maybe we
Hi.
can start with your question.
Awesome. Perfect. So it states in the slides from last July that we're not supposed to be using nail clippers to trim nails of our residents. Instead, we're supposed to be using the emery boards to file them down as a means of trimming. Is this a policy of CDPH, SAG? And what is the role of the SNFs to follow? Like, is this something that we need to follow and adhere to right away, or starting from last year, or when was this changed? Because according to the CNAs that I teach, they were under the impression that they were able to still use the nail clippers as long as they cut straight across, and anything that was pointy was filed down with the emery board. So I'm just a little confused on what to educate my CNAs with, especially my DON and also our policy holders at our in our corporation.
Hi, Nina. Thank you for the question. I did check with our licensing team as I saw the question coming through. So see, on the spot, per CDPH licensing and certification, you are still able to use the clippers to clip the nails, but they're only concerned about for the diabetic patient residents, right? Anybody who's diabetic. So they were only concerned about those patients. And you do have there are certain high-risk population. You do have a podiatry consult, right? So you do have, they are the one who's coming in and making sure that everything is okay. So yes, you'll still be able to do the clippers. The CNAs are able to use the clippers. They just need to be trained, as you said, how they cut it, how close they are to the nail bed, making sure that it doesn't bleed. So those are the way of education. So we can, what we can do is we will be able to get you some more detail during our office hour. If there is any particular FTAG for pertaining to that. So we will be able to get you more clarification, but based upon the conversation, so you'll still be able to use the nail clippers as long as the CNAs are trained appropriately, that's the key factor.
Gotcha. Okay. And then so for the training properly, the appropriate training, because, a lot of our CNAs here have been here for about 20 years, 25, 30 years. And so what are the appropriate trainings for that? And will they need an extra certification? Is it only supposed to be those specific CNAs that have been specifically trained for that cutting? Because I just see that regardless of what their diagnosis is, whether they have diabetes or not, even with the clipper cutting, there is still risk to snip a little bit close. And then it's so much high risk for any type of skin infection anywhere. And so just with the population that we serve here at my program. So that's just what I'm trying to make sure that everybody is safe and everybody knows what they're doing.
We totally get it. So I think this is opening us giving us an opportunity to look into, do we need to develop a video to how to demonstrate the how to clip the nails, right? So we will get more detail on that. So because we always recommend not to go close to the nail bed, but maybe how much close you can go, so that information we can bring it back to our office hour.
Okay. All right. Thank you so much.
Thank you. I just wanted to note someone, Evelyn, chimed in the chat. She said this training, using nail clippers training, as part of the CNA program as part of their scope and ADL care tasks. So, you might, if we look into maybe some CNA training program curriculum, maybe we can
I did
find a bit more information.
Yeah, no, that's what I did. And when I went to my DSD program, she actually owns a CNA program in which she does not include that. She includes nail care, the cleaning, but not the clipping of nails with a nail clipper, the actual action of clipping the nails. Only filing with an emery board, which is why I was a little confused on what to teach to refresh my CNAs for these in-services.
Right. And so you bring up a good point. So this is a great way to kind of update or pick and choose what slides you want to use from our Project First Line curriculum, because we have a slide that particularly says, why don't we use nail clippers? So maybe you omit that from your training and you insert, your video or your demonstration there.
Right. And it wasn't very clear either. It just kind of had a broad statement of why don't we use them, and not necessarily why don't we use them with those who are on blood thinners or who have a diagnosis of diabetes or anything else in that sense. So I'm speaking specifically on the fingernails itself, because we have podiatry for the feet. So
yes, I think it's Nina, as you said, you had to consider about your risk factor for bleeding disorders, right? Somebody who has a bleeding disorder, somebody who has diabetic, somebody so who is and even when after clipping the nails, it's making sure that it is not sharp, it's how the edges are clipped. So we will get you more details if we can find it. If not, so we will work on it to make sure a program includes that. Thank you so much.
Thank you.
Erin, do you see any other questions on the chat?
I do, and perhaps team can make sure I'm not missing any as I scroll through. But Shantala, why don't you go ahead and give your questions to our team here so we can get some more information.
Yes, Shannon, this question for you. We talk about the data a lot, right? And then during using the adherence monitoring tools, so collecting the data, why it is so important to share the data with the frontline staff and the leadership?
Yeah, that's a great question, Shantala. I think initially it just really makes your staff aware that there are gaps occurring or areas for improvement, but makes your staff aware. And then from that, you can have communication where you're able to get a better understanding of why those gaps might be occurring. And then working with leadership and the staff to generate solutions for implementation of proper IBC practices. So it's really a starting place to share that feedback to your staff. Do you have anything else to add?
Thank you, Shannon. I think I'll just give an example, the practical example, what we have seen on the field when we have visited several facilities, hand hygiene compliance. So we talk a lot about the hand hygiene here on this presentation. So when we were looking at why the hand hygiene compliance was poor, there was a lack of easy access to hand sanitizer. Some of them were available, but it was behind the curtain where you had to really go behind the curtain to almost getting into the resident space to use the hand sanitizer. So in some places where it is not even like maybe it's 1 or 2 in the hallway, and expectation was to for the staff to go back to use the restroom to do soap and water. So there was that was an issue, and we were able to also see where they had the hand sanitizer, but the staff did not like the smell of it, the feel of it. So then they said, "Oh, I don't like it, so I'm not going to use it." Right. And then some of them had some allergies issues with that. So did we select the product appropriately for our facility? So that helps you with the data. You're able to identify, Shannon, as you said, where is the gap, and what intervention do we need to implement? And I have a second question to Aurora. So how often do you think this data needs to be shared with the frontline staff?
Yes, that is a great question. And it will depend on your facility. You can do them daily or weekly or monthly reporting. I mean, consistency is going to be a key factor, especially if you want to show the data to your staff so they know, for example, how well they're doing and or what areas they might still need some improvement. So it really depends on your facility, but it is very important that they receive that feedback and that they see it so they know that, how well they're doing. Anything you want to add, Shantala?
I would like to add a couple of more an additional elements is where are this data is shared. So is it shared in your QAPI meeting? Is it shared in your infection control meeting? So where your leadership, your medical director is also aware of the situation. So that helps as an IP or a DST for you to ask for help. Do you need additional help, or do you need additional support, or do you need additional tools? So frequency is always depending upon if you're sharing this data once in a quarter, so then the staff doesn't know what happened the last 3 quarters. So then you may have a high infection rate going on in your building, and CMS is looking at your building to say, hey, this is a concerned building. So it's always good to share your data. The certain data can be shared on a weekly basis, certain data can be shared on a monthly basis. So it's up to you to decide where your gaps are. So once you do your risk assessment for the gaps for your infection control practices, then you can make the decision, I'm going to address our hand hygiene data on a weekly basis because our compliance is only 50%. Now, our PPE compliance is very good, so I don't have to worry about. I'm going to address that on a quarterly basis. And what about your EVS staff cleaning or your own staff doing the cleaning the high touch areas, right? So especially the shared equipment, your vital sign machine, are they cleaning it? So if you do the audit, how often do you report that back to the staff? Maybe that should be in the daily huddle. If you see a huge gap, till they improve, that you need to bring it back to a daily huddle to say, hey, remind them, yesterday when I was doing my rounds, I saw only 2 people clean the shared equipment. Now let's do, so how is your, today we are going to do the, again, audit, and let's look at how our data, how our compliance is improving. So it all depends upon what's going on in your facility. and to making sure that you capture that information, certain information immediately. And you will be able to assess the training needs, whether do you need to do a immediate classroom setting, everybody needs to be brought into the classroom setting to provide the training, or as Shannon, Sophie, and Aurora talked about, taking each of these modules and then breaking it down and then provide the training. Hopefully, I was able to give you all the information. Erin, any other questions do you see?
No, I don't. I just want to invite folks, if you do have a question, feel free to raise your hand so we can see you and let you unmute. Otherwise, if you have additional questions, you can pop those into the chat. I don't see any hands or questions right now. Maybe, Joel, we can go to our next step slide and walk through some announcements. And if you do come up with anything, feel free to get that in the chat. So again, thank you everyone who joined today and for being active in the chat and for all of your questions. We're excited to see, people responding to what we have to say. So just a few next steps. We will have, when you close out of today's session, you'll have a browser pop up with an evaluation. We would love to get your feedback. Take a moment and let us know your thoughts about today's trainings. It shouldn't take more than a few minutes. We encourage you to take a look at that toolkit once we do get it posted live on our website. Again, we'll release it at the conclusion of this week's webinars alongside the slides and the recordings from this week's trainings. Note that there is one more session left tomorrow. So if you want to hear this content again, or if you have a friend you'd like to invite, please go ahead and let them know that we have one more session tomorrow. We are also hosting office hours on this topic next week on Friday, July 28th from 11 to 12 p.m. And you can find the registration link on the slide here and also in the chat. At office hours, we always invite a few nursing homes who have implemented a similar training program using the Project First Line curriculum or other CNA curriculum. So we really want to make create a community for best practices sharing and troubleshooting. So we encourage you to come, bring any additional questions that you have. We'll answer any unaddressed questions from this week's workshops. So we hope you can join us. Again, link is in the chat to register for office hours. And then looking forward to August, we have one more Train the Trainer workshop series in August that focuses on IPC training for our EVS staff. And this is a brand new curriculum that we're launching with our program. Again, the goal is to train trainers, educators at each facility so that you can bring the IPC training concepts back to your staff and get everyone trained on these topics. You can access the registration links to the curriculum, to the toolkits, everything that we talked about today on that Train the Trainer website. We'll put the link in the chat as well, but it's also the same link where you registered. And if we can go to the next slide, we'll go ahead and talk about our CEUs. All right, so this is a lot of information. And if you registered for today's session, you will get this emailed to you. So don't worry too much about taking too many notes right now. Look out for that email. But just to go over all the details, HSAG is the CE provider for this event. They are approved to offer you 1.5 contact hours of CE credit by the California Nursing Home Administrator Program, NHAP, and as well as the Florida Board of Nursing. Do note that the Florida Board of Nursing and the California Board of Registered Nursing do have reciprocity. So the nursing certificate will be accepted by the California Board and will apply to both RNs as well as LVNs. To receive your certificate, you'll access the HSAG's Learning Management Center by either clicking on New User Registration link or the existing user registration link. You'll click the New User link if you've never taken a course with HSAG before or received CEU credit, and you'll click the existing user link if you have. If you're new, you'll set up an account. It's a really simple process. And once you have access to that account, you'll input your name, your license number, answer one question to attest that you did attend today's workshop, and then you can immediately download your certificate. If you don't need CEUs today, but you do want a certificate of completion, follow those exact same steps. You won't have to include a license number. You can just include CA for California, and then you can download your certificate. And once you're an existing user, you can download your certificate at any time if you need to re-download that for any reason. And if you have questions or need assistance with any of this, you can contact Deborah Price at HSAG. Her email is in the chat as well as on the screen. And we do encourage you to redeem your certificate by September 30. That way you just have it in your pocket for when you need to report on it. And so I'm just browsing through the chat again. I don't see any questions. I don't think I see any hands. So I think we can wrap up. Yeah, go ahead.
I think I'm not sure if Jennifer McClure is still on the line. I'm not able to see if she is there. Can she? I see like she has used our CNA Project First Line training, made some quizzes and lesson plans. If she's able to talk about it now, that will be great to give examples to others.
Oh, hi, it's Jennifer. Can you hear me?
Yes,
Yes.
Jennifer, go ahead.
Oh, hi. Yeah, no, I'm a DSD at the Veterans Home in Barstow, and we actually have been utilizing your Project First Line for quite some time. I've used them since probably maybe November of last year. And so I made lesson plans and quizzes, and I do it for my CNA classes, for their monthly classes, as well as for part of onboarding. I incorporate a lot of skills checks and actually policies into that. So I always add, your videos. We stop the videos, talk about things, do the quizzes. It's been very well received with the CNAs, and they actually do really, really well. They've learned a lot. It's helped a lot. And so we're really appreciative here in Barstow.
Thank you, Jenny, for sharing that story. It's always good to hear our efforts are put into practice. So we really appreciate that. Thank you so much.
And kudos to you for really making it make sense for your facility too, and using the modules the way you find it best to use them. We have a request in the chat. I got a direct message. We're wondering if you could share those quizzes and different items maybe on our office hours next week. So we'll definitely reach out to you and see if you're available to join then.
Thank you, Erin. I think there is one question from Erica. She's asking about will there be any workshops specifically for CMS FTAG 945 regarding infection control training? We were planning to bring a couple of slides for our office hours regarding that FTAG, but we don't know yet. So how much detail we can, there's a lot to cover, whether we are able to cover everything in one during our office hour. We will work with our HSAG team to see if that is something in the future we can bring it up, and how soon we will let you know during our office hour. Thank you.
Great, thanks. Thank you all for the questions. And I see Joel put our project inbox email address in the chat as well. So if anything does come up at any time, really beyond the office hours, even, do reach out to nursinghomes@hsag.com with questions, with comments, with stories, like what we heard today, using different ways to implement this curriculum. We love to hear it. All right, so I think we're going to go ahead and wrap up then. This concludes today's workshop. Again, thank you to our instructors, our speakers today. Thank you to all of you for participating. We know your time is valuable, so we really appreciate spending this hour and a half with us today. We look forward to hearing how your trainings go in your facility. And if you have additional questions about today's content or participation in future workshops, again, reach out to us at nursinghomes@hsag.com. And we hope to see you at office hours as well as at our EVS training next month. Thank you, everyone.